Hey, Poofy Organics and Poofy Organics lovers. Anna here, and it is so good to have you tonight. We have a special guest that it's very knowledgeable about babies, breastfeeding, lactation, postpartum. So make sure that you are commenting on this video and asking all your questions because we're going to have Sarah helping us respond online on the YouTube channel. So let me tell you a little bit about her. Sarah, thank you so much for being here
Yeah,
tonight with us. I know that you're taking some time away from your newborn baby.
yeah, yeah. It's fresh. Yep. The
So
newborn period is fresh for me, so I can
you,
bring that tonight.
oh my gosh, you are a mom for a third time. This is your
Mhm.
first girl.
Yes, yep. I have two boys, 7-year-old, 5-year-old, and then now a 3-month-old girl.
So that's a little bit of a change, on
Yeah.
the steering wheel, and we're going to talk
Yep.
about that in a minute. But let's just go a little bit over your credentials, who you are, what you've done, because you are a registered nurse and you
Yep.
have been, correct me if I'm wrong, on obstetrics and postpartum for over 10 years.
Yep. Yep. I've been in OB nursing for a little over 10 years. And I really enjoy, I would say I favor postpartum nursing. That's like my go-to if I have the choice. Yeah, and then now I'm a certified breastfeeding specialist. I just got that certification, so
That is
going that direction.
super interesting. That is super interesting.
Hmm.
And I know that I mentioned this to you when we were talking about this interview, and I'm just going to say it here because it's one of the things that impressed me the most when I moved to America was I had a friend that had recently had her baby, and she was from the same country that I'm from Venezuela, and I saw her pulling something like a cape that she put around her neck and cover that baby, and it was black on top of everything. It was a black
Yeah.
cape. Breastfeed her baby,
Yep.
which I thought was extremely weird.
Yeah, there's
Back in
so
my
many cultural things about breastfeeding. It's funny you mentioned that.
The whole time I was thinking, how is this baby breathing? Like,
Yeah,
how do you know if it's breathing or not? Because I
right.
remember when I breastfed my babies, I kept like one hand,
Hmm.
pushing my breast to make sure that it wasn't covering her nose, right?
Yeah,
And
right,
here she
right,
was like all covered. I'm like, okay.
right.
So there, and now I've come to realize that that's the way of doing it here. Thank goodness I'm not having any more babies
Yeah,
at this
I
point.
know. Hopefully, our culture shifts a little bit, and I think it's
It's
becoming, there's laws in place, and it's
Is
becoming
it?
a little bit more
it-
normal
But
breastfeeding.
what is it? Is it embarrassing
I guess so. Yeah. I mean, I
for
think
the mom or for the viewer or for both?
I think in our culture, I think it's more embarrassing for the viewer, in my opinion, just based off of like personal experience and what I've like gotten the vibe in the hospital. It's just, but it is a little bit of our culture. I think that's just something, I don't know, Americans have created somehow, but it's so different in other countries. When I visited, I'm like, this is how it should be with breastfeeding. You just feed your baby when they're hungry. You don't have to
It-
cover up, find a place or a bathroom or something crazy to
In the
nurse them.
bathroom. Oh my God. Thank goodness now there's like special pods for breastfeeding that are not a
Yeah.
public bathroom because I
Yeah, they
spend
have them
as
here.
little time as possible in a public bathroom.
Oh, yeah, no, it doesn't seem like the most sanitary place to breastfeed. I prefer not to do that.
Now,
So,
tell me a little bit, when you are working with patients,
mhm.
what are the standard questions or concerns that pregnant women have, in the face of having a baby
Oh, wow. Just like related to breastfeeding, or
related to breastfeeding specifically?
I would say the most common, even across different cultures in America that I've seen in the hospital is my baby getting enough milk? I feel like that's like the number one question is, are they getting enough to
Um,
eat? And it's so hard. And like, becoming a mom a third time, there was a little bit of gap in between this baby that I just had and my second son, who's 5 years. I was reminded of all those like fears and anxieties that come to you, and like you have to remember too, you're going through so much hormonal change when you're, pregnant and you have the baby. Your hormones are rapidly changing to your body is compensating to now breastfeed and feed a baby and heal your body and everything. So it's natural to have some, hormonal changes and anxiety and worry over that. Just how am I going to do it all? So I'd say that's probably the most is my baby getting enough? And yeah,
How do
later
they know they're
too,
satisfied?
you go, no, go ahead if you have
How do
another.
they know if they're satisfied or not?
Yes, yes.
Yeah, well, if I recall this correctly, because the youngest kid that I breastfed is 21 years old now. When they go like,
Yeah. I call it milk drunk. I don't know if that's not a proper term, but
yes.
I love it. The milk drunk. Yes, it's good. That's always like when you see that, everyone's happy.
Sarah, are there any recommendations for someone that it's producing or that feels that it's not producing enough milk, to help ramp that up? I remember that I had some friends that was their main concern.
Yes.
I never had
Supply.
that issue. I think like when during my pregnancy,
Hmm.
being pregnant, I would get into the shower and start like spraying milk
Yeah.
in
Right.
the
Well,
shower.
right. Because you start
There
making
were,
milk when you're pregnant. Yeah.
but I had some friends that even after having their baby,
Hmm.
they're like, "Oh no, this baby is clearly not getting enough milk because and if they pump, they were like 2 ounces.
Right.
While some
Right.
other people I could pump 8 ounces easily."
Right. Right. I mean, I would say, whoever, if you're watching this and you're pregnant or are struggling with supply issues, one, it's so based off of the individual, and it's a mystery. It's hard. It's like, healthcare in general. It's so different for each person, why they might be experiencing something, and or symptoms or lack of milk supply. So try to see a feeding specialist, lactation consultant in the area. You can find that through like a local hospital or doctor's offices. You'll be able to find one. Highly recommend because they can, you know, assess the patient and assess what's going on and just look at everything, the whole picture, the big picture of things with the baby and the
Right.
latch. Um, and also just like a general recommendation when you just gave birth, it's so this is probably like one of the biggest things we learn in nursing as an OB nurse. And it's the most simplest thing too. As long as you are medically stable and the baby is, always put the baby skin to skin when they're first born. It naturally induces oxytocin release, which is something that mom needs and the baby needs, and it induces lactation further and the letdown for milk to for the milk supply to start. So do that as much as possible, even when you're home. Weeks later, when your baby's fussy, highly recommend skin to skin. It's something natural, it's something easy to do. And yeah, that would probably be my
Let's
easiest recommendation just in general.
What are the benefits of the skin to skin for the baby? And I'm asking you this in a very intentional way, and then I'm going to explain why.
Okay. Yeah, there's so many. So the first home for the baby, if you think about it, is inside mom. So you the mom is their first home. So the sound of her heartbeat, temperature regulation. And with the newborn, they're so new to this new environment when they're born that it's going to be a huge adjustment for them. So that's why it's hard we put hats on newborns. It's hard for them to regulate their temperature. It's can be difficult for them to regulate their blood sugar if they're, especially if they're like a little bit early or if they had a stressful delivery for whatever reason. So, skin to skin helps with not only milk production, but temperature regulation, blood sugar regulation. pretty much helps that is sometimes when babies have trouble breathing, even putting them skin to skin can help resolve their breathing issues. It's really amazing what I've seen.
Have you heard of any benefits on supporting the baby's immune system?
Yeah, for
Skin to
sure.
skin.
Right, because I mean, if you think about it, when they're skin to skin, they're more relaxed, there's less stress, there's less cortisol. They're it's going to help their immune system. When the body is under stress and your systems aren't working, then your immune system is going to be meh, it's not going to work as well. So absolutely, it will definitely increase and help their immune system get a little kickstart. So, and it helps with milk production if you are planning to breastfeed. And that is a huge, huge benefit for the immune system. The milk, natural, breast milk has so many like antibodies and just so many good immune support for the baby. It's just a natural process that really works.
That is remarkable. Sarah, I'm going to share this with you. My third kid is adopted,
Yeah.
and we received Eliana when she was 9 days old. And she was at the NICU at the time because she was a preemie. And
Okay.
I remember the nurse she had on the evening shift. She told me that if I wanted to, we could do skin to skin, right?
Yeah.
At that time, I was like, "What is that?"
You're like, what?
Because in my with my two bio kids, I guess we didn't have a label 20 some years ago for
Right.
it. You
Right.
know what I mean? Or maybe you did in
Mhm.
America, but not in third world
Yeah.
countries.
Well, I think that actually
So
skin to skin wasn't always a thing. Like my mom said that they would in America, you'd wrap the baby up, take them away, put them in the nursery. So much has changed, especially in the hospital. At least that's where
now
I
you
work.
have them in your room with you the whole
Yes, yep,
time,
rooming it.
and that's awesome.
Yep,
So we
so much
did,
has changed, and it's
all
a
of us.
very good
All
change. Yeah.
We were four adults in my family at the time. In my girls also wanted to do skin to skin with the new baby that we were receiving. And the nurse was like, the more the merrier. It's great for her immune system. She's going to get used to your smell. That
Yep.
she's going to feel a part of this
Right.
pack. It was very
Exactly.
significant for our family, for my
Mhm.
husband, and for us to do skin to skin with
Mhm.
our newborn baby that we were adopting. If I reflect upon it, it was kind of like symbolic way to say we belong together.
Yes, absolutely. And it's such a great way to bond, whether it's your biological child, adopted, foster. That's what probably my number one recommendation for a newborn and any parent, any foster parent, anything.
I
Definitely,
love that.
definitely skin to skin.
So let's talk a little bit about postpartum because I've heard in my years of non-medical involvement
Mhm.
whatsoever a wider range of emotions and mental health, related situations that
Mhm.
happen after you deliver a baby,
Right.
anywhere from anxiety,
Hmm.
depression, rejection, fear, um, overexcitement, the opposite,
Hmm.
right? So
Right.
let's talk a little bit about the wide range of emotions,
Hmm.
what's common, and how do we reassure our audiences on the idea that it is normal.
Yeah.
It's
Oh my goodness.
normal,
This is
and
such a
and and when
yeah.
do they need to seek for help?
Right. This is such I guess you call hot topic in postpartum health. I mean, I feel like we've come so far. I like because I just went through postpartum myself, still am in the postpartum period. I'm only 3 months out. And we now screen at pediatrician office when you take your child for a visit. Your OB follow-up appointments, we do those sooner now, like at 6 weeks. I had a C-section, so this time around, so it was like a 2 week appointment. They screened me then, and I think it's improved. And I think that at least in healthcare, it's going to keep improving. And I hope that so much for moms because I don't know the like exact statistics, but postpartum depression, anxiety. I've even heard the term like post. It's not a medical term, postpartum rage, like just like feeling super overwhelmed, like you're gonna like
I
like I can't
I
take the
believe it.
crying, I can't
It's too
take
much.
but
It's a
anything.
lot.
It's all just so overstimulating. I would say it's pretty normal. And I say most moms experience it at some point to some degree, and some it's, a lot worse for others. And I would say when it's become to the point where, you're having serious um, symptoms of depression, like, you're not able to cope, you're not able to get out of bed, like anything that you would, a normal, like if what you hear for normal depression, if you are experiencing anything like that, tell your spouse, your partner, whoever, your whatever support person you have, and ask them to get you help. You can even, if you feel like you're having some serious, like, abnormal thoughts, there's a thing called postpartum psychosis, even. It's rare, but it can happen. Go to an ER and tell them that you just had a baby and this is what's going on. I know that's scary and it's a lot, but I think women in general they need more support in this area. And I'm glad that it's changed so much that we're, screening for it more, and answer those postpartum depression screening questions as honestly as you can, because you deserve to get help if you need it. So that's
I feel there's this expectations that we impose on ourselves
oh
as
yes,
women, you know?
definitely. You
And
can't do it all. You can't
it,
do it all.
I remember being pregnant with my first one.
Mhm.
I had decided that I was going to have a natural delivery for this
Right.
baby, right?
Yeah.
And I was set on it. And thank goodness no complications arise, because it would have been very difficult to disengage from the plan that I had made in my mind,
Right. Right.
and how I had thought that this was going to go and what the outcome was going to be.
Hmm.
If anything was changing at that moment, it would have thrown me off my game completely, because
Hmm.
we create these expectations for months, right? When
Right.
we are pregnant, on how we want
Right.
the delivery to be.
Right.
And when you know, my waters break, and my
Right.
waters, it never broke, for
Right.
example. Just
Right.
to give you an
Right.
example, my
Didn't
water
break.
never
Yeah, like
broke. It
you
had to be
thought it
broken
should. Yeah.
in the hospital by the doctor.
Right. There's only so much we can control, and you know, there's definitely it's
If there's
huge.
if there's any message that I wish we could convey tonight, is the message of be graceful to yourself.
Yes, be gentle with yourself, especially postpartum. And during pregnancy, it's normal to have, feelings of inadequacy and insecurity alone, even when you're, a mom or about to be a mom, but it is hard, and then your body is going through so much physically, but not just physically, mentally and emotionally. So I think that's the
And
best piece of advice.
you
Or
know,
mhm,
in Latino families, Sarah, when you deliver a baby,
mhm,
there's it's a family celebration,
mhm.
and people come in from different places to visit,
Oh,
and they
that's
stay
awesome.
forever also, you know.
Yeah, big
and
stay right.
and so you have a lot of hands helping all the
Yeah,
time, which is
right. That's
a
amazing.
relief for a newly for
Yes.
a new mom.
Hmm.
And someone is taking care of the kitchen, someone's taking care of the laundry, someone's taking care of the husband, someone's taking care of the house, so you only take care of the baby,
Hmm.
and someone's taking care of you
It's amazing.
also. It's amazing. And I remember one of my aunts, my mom twin sister, she told me with my firstborn, she said, uh, I asked her, how am I going to know if this baby's cold, or
Right. Right.
or if she's thirsty,
Yeah.
or if anything itches.
Right.
She was like, it's super simple. If you're cold, they're cold. If
Yeah.
you're uncomfortable, she's uncomfortable.
Right. Right.
If you so it's
That's
easy.
a good, that's a
You
really
don't
good
even
message.
have to
Yeah.
check, because I was like
Right.
checking on her nose, checking on the back of her neck to see if it's cold, if it's
Right.
hot, if
Right.
it's sweaty. She's like,
Yeah.
this baby is connected to you because she's been
Yeah.
9 months inside of your belly.
Yep.
Now she's out of your belly, but she's still
Mhm.
connected to you.
So
So
true. Yeah.
whatever you feel in
Spot
your heart
on.
she needs
Yep.
it.
Yep. Spot on. I love it.
I feel like the weight of the world has been lifted from my shoulders.
Yeah. Right.
If you
I'm
just
happy to
trust
hear
your
that.
instincts,
Mhm.
right?
Trust your instincts, and accept help. Let people come over when your house is a chaotic mess. I feel like I did that the most with this third baby because I had no choice. Because I had two other kids and you accept help, I'd say be kind to yourself and just let it go, it's not forever, the way you feel if you are feeling not yourself.
Love that. So, when it comes to postpartum, now let's talk about the physical
Okay.
changes, right? Like, so we've talked a little bit about the emotional side
Right.
of it and the psychological side of it. But if you had a natural delivery and how do you say this in English? An episiotomy? Like they cut,
Episiotomy,
when
like,
they cut you,
yeah,
then now you have a wound,
yeah.
right? Or
Hmm.
if you had a C-section,
Hair.
then you have a
Right.
different type of
Right.
wound. But
Right.
in any case, you're wounded.
Yes. Yes.
And
Unfortunately.
so caring for it in the proper, caring for the wound, the pain, your organs are coming back to the right position, what are the things that we should avoid and the
Right.
things that you encourage to women that are recovering in the postpartum?
Yeah, I mean, so in general, if you had a natural or vaginal delivery, you probably are going to tear or did tear, or like you said, in some cases, in a cut episiotomy, which is not fun because you have stitches, which will dissolve. I feel like that's the most commonly asked question. They're like, "Do I have to get these stitches out later?" No, they should normally put in ones that dissolve. But your doctor will check up on that, or your midwife, 6 weeks usually later. You just want to rest, obviously. I would recommend, um, they don't recommend like putting anything in the vagina afterwards at all for 6 weeks. You need to heal down there. Showers, don't submerge in water. Um, there are these like sitz baths that we can recommend where it's just more like water underneath and you can kind of rinse off with I don't know if you got the squirt bottles when you just just gentle, like if you have a soap that you want to use, maybe unscented, something gentle. If you feel like
Mild.
yep, everything mild. I would say everything postpartum for mom and baby, mild. And that's, yeah, I know we'll get into it more, but that's why I love Poofy Organics because they have all that. And I didn't have that with my first or my second. It's been such a different experience for me now with my third baby being able to use.
So tell our audience,
Mhm.
how did you get involved with Poofy and why?
Yeah, it's a big, big why for us. So in 2020, my husband Brian found a lump in his neck. And he went to the doctor, got a biopsy, and found out it was thyroid cancer. And that was March 2020. And that was, a wild year for so many of us. My husband's also a nurse, so he worked in the hospital, was dealing with the pandemic as well. High stress, high stress. And then now he found out that he had cancer. So it was just kind of like our world was flipped upside down that year. Now looking back, I'm grateful for where we've come from it, but it was hard. And we had just had our second son in January of 2020. So, and then March, he found out he had um, cancer. So, talk about postpartum stress, anxiety from everything. So, that's where I was at. Thankfully, he went through surgery and radiation and has been cancer free, knock on wood, and thank the Lord since then. But when you get a cancer diagnosis, you just really, especially when he was 32 at the time, you wonder why, like was it something I was using? Was it something environmental? Trying to make a very long story as short as possible, he ended up getting genetic testing because his parents both unfortunately had cancer and passed away from cancer too. So it's a big part of our story and just how we've changed over the years and grown. But he did find out that he's thankfully not genetically
Predisposed.
predisposed to yes, I couldn't think of the word to any cancers. So it probably was something environmental, like, could have been the personal care products we were using, who knows, or food, stress, something in the environment. So we just try to change a lot of different things in our lives. And thankfully, I had a friend that had already introduced me to Poofy Organics, but I had only bought a couple things because it wasn't natural products wasn't like super important to me until that year when I really dived into like ingredients and things that could potentially be carcinogens or like toxins is the word that you hear a lot. Um, and I was like also really like taken aback by like the mom baby products out there too, over the counter, like some of the ingredients in it. I'm like, that shouldn't be in that. And it's frustrating and like, it's a lot. It was a lot to look into. I'd find myself at Target and like Walmart, wherever I was buying things and like looking at ingredients and trying to figure out which ones were okay and ones that were like synthetic and not. So I was so grateful that my friend had introduced me to Poofy, and I learned that it was started because of the same reason that I'm doing what I'm doing, like why I was looking at labels. So I was like, oh my gosh, they have everything. And it's gentle. The mom baby products too, especially like a lot of them are either unscented or they have, if they are, do have a scent to it. It's like a essential oil that's gentle and not abrasive, and it's generally safe for babies. So it's huge for me. I was like, oh my gosh. So I became a guide because I was buying it anyways. And I love it. And I love sharing it with people. I love giving gifts to people. Everyone's been very appreciative, especially if I find out someone like I know has cancer or like a family member. I always like, give them the gift of the Poofy Organics because that's why it was started. And it's such a cool company and I love it. So,
Yeah, there's definitely a connection between the genesis of Poofy and that diagnosis
yeah. Hmm.
and to your point, sometimes things happen in life that makes us reevaluate our choices,
Right. Hmm.
not because the products could prevent or treat or cure any disease,
Right.
but because the one thing you can control when you are confronted with a diagnosis like this, it's what you choose to eat, what you choose to
Right.
put on your skin, what you choose to clean with, right? So
Right.
since you cannot control the outcome of
Right. Exactly.
the disease, at least you can control this part.
Right.
That
Exactly.
that gave me peace of mind personally
Definitely.
when I was going through my own diagnosis.
Yeah, definitely.
Now let's talk about newborns
Hmm.
and things that we experience as mom of newborns,
Hmm.
and then let's talk about how the products can help us,
Hmm.
in this journey.
Okay.
You
Yeah.
mentioned June had, I want to say this right, cradle cap.
Yep, she has cradle cap, and then she also already had eczema. My first went through that. It's funny how every baby's so different, and I'm like exclusively breastfeeding. Thankfully I'm able to do that, and I'm grateful for that. But you're like, I remember as a first time mom when my first son had eczema and cradle cap. It's so hard to say. I don't know why. Uh, I was like, ow, no one told me about this. Like, it's so stressful when you like feel like your newborn, like you were saying earlier, is uncomfortable and you can't figure out why. And, um, just a personal note on that, like with my first, I didn't know about Poofy Organics or natural products and how they can help alleviate some of those things. And I feel like I tried everything out there over the counter on the market, like for eczema. And I went to my pediatrician and they tried to help and they gave good recommendations. But, now with my third, I feel like so much more confident and I feel like she's doing so much better, so much sooner. And it's just like, it's such a relief. Um, and because we talked about this earlier, I did look up, I like to like kind of, there's like in a sense, there's like the holistic world and then there's the medical world. Well, I like to like be in the middle. And since I have both of those backgrounds now, I'm like, let's join the two. So I was looking, up like Cleveland Clinic and Mayo Clinic and the Academy of Pediatrics online, like what they say about eczema and what their recommendations are. And my pediatrician to give me these recommendations, they say, start with mild soaps, typically unscented. They also say use things that, they said that over the counter creams can have preservatives in them, so be aware that it can cause stinging. my firstborn experienced that, and that was super stressful because I was like, this cream, this lotion is supposed to be helping, and it's making his eczema worse, and I didn't understand why. So they do say that online, that is a possibility. Um, yeah, and that was from the Academy of Pediatrics that gave that recommendation. Um, and then of course, like you can put your child on steroid cream if they have moderate to severe eczema. My first did, and that's something that you can do, and it helps alleviate it, but it's kind of like a band-aid fix, and at least for me, my personal experience with it. And you don't want to be on steroid or put your baby or
On a long
yourself on
period of
steroid
time.
creams long term, So um that was something that, I learned over the years. And now with my third baby, I have such a different perspective. Um,
So
so
what
yeah.
are you using with June
So what am
specifically?
I using? Yep. So I am using, I can't say enough about this product with Poofy. It's the greener than petroleum. So you can use it as butt cream. You can use it for eczema. I have Cradle Cap. A side note on that, it's a very normal. Most newborns get it. They don't know the exact cause. It's just flaky yellow skin that is on their scalp. It probably is from hormonal changes because the baby goes through a lot with being born, and then if they are breastfeeding or not, or and it's something that usually resolves over time. They recommend an unscented shampoo, so I use the unscented soap from Poofy. Love it, such a good one. You can use it as an adult too if you have sensitive skin. That's what I love about like natural products. They have so many uses.
That's the
But
everything soap, right? The
Yep,
everything
the
baby. Okay.
unscented everything soap.
Okay.
And then the greener than petroleum, I kind of use that head to toe on her. Um, it's unscented. It's two ingredients: organic beeswax and organic sunflower oil. And it's with I since I am breastfeeding, I found out that she might have a little sensitivity to dairy. I found that out through the help of a lactation consultant, so highly recommend, if you are going through all this with eczema, see a feeding specialist, talk to your pediatrician, talk to a trusted provider, try to figure out like the root cause of why they
That
might
means
be having inflammation.
you are not eating dairy, or you have reduced your dairy
Correct.
so that you don't pass it on to her when you're
Correct.
breastfeeding.
Yep. Yep. That's
Okay.
not, necessary for every breastfeeding mom, but if your child is experiencing eczema, something to think about. Okay, keep a log of the food that you're eating because baby's getting a little bit of that too in the breast milk, and maybe something you're eating is aggravating it. Yep, I later found out my first son had an egg allergy, so I was like, that was it probably. It's so hard as a parent. You don't know, like you're saying, what's causing something, but you
But I
know,
love that recommendation of keeping a log. You know,
yeah, definitely.
I remember with Cece, with my first one, she was colicky. She had
Yes,
colics every single day for
yep,
3 months at the same time every
yes,
day. And it was her first kid, and it was
yes.
very stressful to have
So
a child that it's
mhm,
nonstop in crying, right?
yeah.
So
Hmm.
I should have kept a log, but I was 24 years old, so I didn't. I started removing foods from my
Hard.
diet until I was just eating on rice, like living on rice, something like that, you know?
Right, right.
I started
Oh my gosh.
including things back
Right,
one at a
right.
time and measuring it. But keeping a log would have helped big
Hmm.
time.
Hmm. Definitely. And just something that is it just a little bit about the colic too. My third baby and my first experienced that as well. And like with my third, you something I have to remind myself as not only a nurse. Oops, sorry. Can you still see me?
Yeah, I
Okay.
can.
Sorry, my phone is acting up a little bit. But not only as a nurse, but like as a mom, newborns, they have like an immature system, and like it just takes time for them to grow and like be able to like regulate their bowels and be comfortable. And the colic thing is unfortunate, it can happen to more than, I would say a majority of parents, and just remember that it's a short time. It seems like forever and it's super stressful, but that's another thing I needed to remind myself of that with this third baby.
I'll tell you something that I wish someone would have told me, Sarah, and I've come to learn this with our third kid,
Hmm.
is there are certain things we as parents, we have the idea that we have to fix things.
Hmm.
If
Right.
my baby's uncomfortable, I have to, it's my
Right.
responsibility to
Right. I
fix
think
it.
it's a natural instinct, right?
And if I can't, I feel like I'm not doing a good job,
Right.
right? So one thing that we've learned with Eliana is sometimes things don't need to be fixed.
Mhm.
You just need to be there,
Right.
present,
Right.
and
Right.
help them go through it because
Absolutely.
time will resolve it. It's just
Hmm.
more of being a companion
Right.
and a safety net,
Right.
to hold them
Absolutely.
throughout that process. And that has been a hard pill to swallow.
Oh my
But
goodness. Yeah. I feel like that's parenting, like quality parenting advice too.
but
Oh my God.
I
Every stage, right?
but
Right.
if we can help any new
Mhm.
parents, receive this
Right.
early on
Right.
and it reassure them
Right.
that it has nothing to do with what you're doing or
Yeah.
not doing.
You're not doing anything wrong.
They just need to
Hmm.
mature. And
Yes, absolutely.
the best you can do is hold
Right.
them through
Right.
that process.
Absolutely. Yes. Love it.
Um, I saw you making a post about our nipple cream.
Yes. That's
And
my other top three in my top three.
so how do you use it? Because I think that you use it for more than one thing. So how do you use it
Yeah.
and how does it help?
Right. So it's vegan and it has great ingredients and you don't have to wipe it off. And, most nipple creams, that's what they advertise. But this one, Poofy takes it a step further. It's vegan, so you're not going to have any like lanolin in it or anything like that. So you can use it. I used it on her eczema when I couldn't find my Greta the Petroleum upstairs. I had my nipple cream up there, so I use that on her eczema. I use that on her cradle cap too because I like you don't have to put anything on cradle cap, but I put a little bit on and it kind of loosened it and it made me feel better. Not that it bothers her. It's more about the parents sometimes. So yeah, so many uses. You can use that on their bottoms. Like it's not a one. It's for mom and for baby. It's awesome. So
Do you
um,
use the nipple cream in between feeds
yeah.
to
Mhm.
recover and
Yep.
rehydrate?
Initially, even though I didn't have like nipple pain or issues with latch, I still, when you start breastfeeding again, your nipples and your breasts have to get used to that
Yeah,
again.
they're
So it's
sensitive.
sore.
Yeah.
You can be sore. So, you know, if you have doubts, always see a lactation consultant or get that checked, but you can put nipple cream on in between and you don't have to wipe it out off. The Poofy one also kind of like melts and it's wonderful. Love that product. So
Okay, and then you said you can put them on their tush. We also have a product called Baby Tush that I use
yeah,
with
happy to.
Eliana,
Yep,
the
love
Happy
that too.
Tush.
Yep, it has
I
zinc
use
in
it
it.
with Eliana, and to this day, I use it on
Yeah.
many things
Oh
myself as
yeah,
well. To be
it's
honest
all
with you,
amazing.
it's a
I love it
product.
that you can use it for so many things.
Yeah. So my go-to, if you get a bug bite,
Hmm.
it's salve. But I ran out of salve. I just got a new jar yesterday, but I ran out of salve for a couple of days. And I was like, I have the happy tush. So that's what
Yeah.
you're getting.
Yes.
And it did help.
Yep. Yep. That's what I love about natural products. So many uses, not just what it says it's for.
Outside of mom and baby line,
Hmm.
things that moms experience as part of their postpartum that could be alleviated, or eased
Right.
through other things that we may have on the portfolio, or not even things that are poofy related,
Right.
like if
Right.
you say, listen, one thing I remember when I gave birth to my first two kids, we didn't have, are you almost out of battery? You tell
I
me,
think so. I'm
you
so sorry.
do this when you're
I
out
need
of
to
battery.
plug it in soon, so I apologize.
You're so good. You're so good. We're gonna wrap it up.
Okay.
um there was no such thing as those donut pillows that
Yes.
you
Yes.
used to put, that didn't exist when I was a new. And with Eliana, they did exist, and
Okay.
we got one, and we used that thing, like forever.
Right.
Like,
Right.
so, any hot recommendations that you would give to close this segment, that you would give to someone that it's about to have a baby or just had a baby that would make their life easier.
Hmm. It's a great. I would say just have a comfortable spot, especially for breastfeeding. Make sure you're comfortable first before you try to latch the baby. That's something that I didn't realize. I was like, hunching over, didn't have like proper pillow support.
Okay.
Always have a comfortable spot. Have your water nearby. Hydrate, hydrate, hydrate.
Get
You
very
can use
thirsty.
the greener than petroleum, another poofy use. You can use that for your lips. You get really dry lips when you're breastfeeding. I forgot about that. You sweat a lot. Get a natural deodorant. There's so many things I could talk all night about postpartum support. I love it. So make yourself comfortable though when you're trying to breastfeed, and especially if you're sore from giving birth, try to give yourself a comfortable spot to sit or sit up in, and lots of support like pillows and everything.
Okay, Sarah, thank you so much for
Yay.
devoting this time
Thank you so
to
much for
us
having me.
and for sharing your knowledge. I am going to close today's interview with some news. Starting tomorrow in the morning, we are going to be sending out a communication with a new coupon code that can be applied to mom and baby products with any order of $70 or more. So the code is going to be baby10, and it will give you $10 off your order of 70 plus, that it's including mom and baby products specifically. So you need to accomplish $70 plus with mom and baby products, and you can apply the baby 10 for $10 off
Oh, that's awesome.
that order.
Very cool.
Yeah.
Yeah.
So thank you so much,
Thank
and
you.
have a great rest of your night. And let's just make sure that we can cover those questions that are going to be posted in the next few days.
Absolutely. Thank you so much for having me, Anna. I
Have a
appreciate
great day.
it. You too.
Bye-bye.
Bye.